Well, welcome back. Is your preschooler having some trouble sitting, paying attention, or controlling impulses? Well, parents worry these behaviors are signs of attention deficit hyperactivity disorder, but you shouldn't rush to diagnose or medicate for such young children. We have Tamara Atala here, a licensed clinical social worker and administrative director of behavioral health services at Primary Children's Hospital. Hopefully I got that title right.
Absolutely.
Okay, yeah. Thanks for coming in. First of all, we're talking about preschoolers here.
Correct.
Is it hard to diagnose ADHD?
Well, I think the important thing to recognize is that preschoolers in general, I mean, impulsivity, absolutely. And so to just simply recognize that that's normal. It becomes a challenge when they actually deviate away from what's developmentally normal, and it becomes really problematic in their daycare settings.
How can you differentiate that and about what age?
So typically speaking, we don't like to diagnose ADHD until the age of 4. And so it's really important to recognize it's really about when it becomes disruptive for them to function in daycares, or when it's difficult for them to function and have relationships with their peers or with family members and those sorts of things. And what we really want to consider doing is, if they have concerns, to make sure that you talk to your pediatrician or a behavioral health professional to get screened first.
Okay.
And what we want to do with that actually is to make sure that we focus in on behavioral therapy first, which is a little bit of a shift, and then consider medication second.
Right. And do you think that there's been a lot of over-medicating going on? Or?
Well, I'm not sure if it's a matter of over-medicating or not, but what the American Academy of Pediatrics recommends is to first consider behavioral therapy first, and then if that's unsuccessful, consider something different. And the reason for that is we want to use the least invasive interventions with such young children to avoid any unintended side effects. And so what we know is when you take behavioral health therapy and you train families, it really becomes a toolbox for families to consider training them, shaping behavior, and really having a better outcome overall, rather than jumping right into medication.
Yeah, well, that's great information and a source where people can go to get more info.
Absolutely. You could consider going to CHAD, which is an organization that focuses on ADHD, or certainly you can check Intermountain's website as well for ADHD.
Okay, Tamara, thank you very much.
Absolutely.
And still to come on Tunas at Noon.